Introducing the Baxter family. Today's topic is about mitral stenosis. It's a fatal heart condition where the valve is so stiff that it doesn't allow blood to properly go through it. Therefore, it backs up into the heart and causes congestive heart failure. Actually, there is a 50% mortality when you are diagnosed with this condition. I have my family here together because we are going to learn about this condition so that we can be informed caregivers. We just recently found out that my mother-in-law and my father-in-law both have this condition. My mother-in-law, who's 86, and my father-in-law, who's 88, are both very functional people, live by themselves and do well, and we really want to make sure that they continue to have a good quality of life. And it's always best that if your family knows what's going on, then everyone's involved in the decision. Let me introduce myself. My name is Darlene Baxter. I am an assistant nurse manager at the Wake Forest University Baptist Hospital. I am a nurse there in cardiology. I work in a 20-bed CCU, which is the cardiac care unit, and we're associated with Wake Forest University School of Medicine. Let's talk about the pathology and the anatomy of the heart. The mitral valve happens to be the last valve that blood goes through before it goes to the rest of the body. So if you remember, you have two atriums on top and two ventricles on the bottom. On the left ventricle, as blood comes through, and the last valve where blood goes through before it goes to the rest of the body is called the mitral valve. And so you understand why that is such a crucial valve, because your heart has to pump pretty hard to get through that valve anyways to get to the rest through the body. So, and what causes mitral stenosis can be certainly age, and then high blood pressure, diabetes, smoking. IV drug use is really bad because if you use dirty needles, then that infection can go straight to your heart and cause problems. And another problem called rheumatic heart fever, that used to be very prevalent back in probably in the 30s and 40s, 1930s and 40s, when the Baxter were young people, and that a lot of people got that, and it really damaged their heart valves. And anytime you have radiation done to the chest, especially during cancer treatment. Treatment normally is open heart surgery, where they actually cut the sternum, spread the ribs, and go in directly and cut out the valve and replace it either with a mechanical valve or a pig valve. And that's a very extensive surgery that requires a lot of healing time. They'll have a lot of pain, and they also have more chances of infection and bleeding during that surgery. Now, the second option that just happened to come to our hospital in the last year is that we take them to the catheterization lab, and they actually perform a catheterization, and the doctors plus a surgeon at the side will go in through the groin and go in and take a balloon and actually spread that mitral valve apart and make it non-functional, and then they take in another heart valve that looks similar to a little small basketball net. And my daughter will zoom in on the picture of the valve. The flaps are actually made out of a cow heart leaflets, and then you'll see the metal frame around it that is there for stability, and then there is a fabric skirt on the very bottom where the doctors will sew that down to the old valve that they had already ballooned open. The only thing about that procedure that's very high risk is the chances of a stroke afterwards because of the manipulation of that old heart valve. So, but the recovery time is really quick on that. In fact, they'll be up in the chair the very next day. This third option is to stay on medication and just treat the symptoms as they come with the heart failure. So that is our three options that we have. Because of their age and because Mrs. Baxter has had previous slight strokes in the past, and she's on Coumadin, which is a blood thinner, And Mr. Baxter also has some bleeding disorders where he's had problems even with a pacemaker insertion. He would swell and bleed. So they both have bleeding difficulties, and because of their age, they would not be candidates for heart surgery. So we only have two options left that we need to make a decision about. And what concerns us the most is that the complication of strokes with the second procedure where we put in the net-looking heart valve through the heart catheterization lab. So, but we want them to have quality of life because they're such functional people as they are now, and we just want to make sure that their life is as happy and healthy as we can make it. So as informed caregivers, we have learned about mitral stenosis, the complications, and we know what we're up against. So when we go to talk to their doctors in the coming weeks, we'll be able to make an informed decision about their health care. Thank you very much for your time.